We are back with Dr. Cynthia Snyder, Cone Health's Infection Prevention Medical Director. She's talking all things flu. So we always wonder, when is it time to go to the doctor? When is it time to go into the office? When is it time for the virtual visit? When is it time for the emergency room when it comes to the flu?
So if anybody's having significant respiratory distress where you're having difficulty with walking, and breathing really short of breath, those are the times when you need to seek care very quickly, where you're going to the urgent care or going to the emergency room. However, I think if you are otherwise fairly healthy and don't have that much discomfort from it, you don't necessarily need to seek care. However, if I think folks who have multiple medical problems, the problem with flu is that it can trigger the worsening of other problems, especially if people have underlying lung disease. It can cause maybe some you notice differences in your blood sugars for diabetics, or people notice chest discomfort, maybe chest pain. And so in those cases too, that's when you should seek very urgent care. When I would call your primary care doctors, and they can help assess having you either come in person versus coming in or doing a virtual visit. I want to dissuade people just to show up at the emergency room for testing. That's not the right place to get care. And luckily though, we have many sites in the community. There are several minute clinics, such as at CVS and Walgreens, that can test for both, right? Can tell you if you have COVID and flu or both. And especially we have access to antigen kits, right? So that's also very important, that you yourself can go out and test yourself. And if your COVID test is negative, kind of doesn't mean you have a clean bill of health, right? You still should see how you're doing and follow up to being evaluated for flu, and if you need antiviral therapy.
Yeah, going to the emergency room just to get tested, whether it's for flu or COVID, I mean, you could be waiting there for a really long time, and then it kind of backs up everybody else who's got some more acute issues.
Correct. We just want to make sure people are seeking care at the right venue, and a lot of I think doctors' offices may also have access to testing for flu and COVID. So it's that'd be one thing to ask when you call to make your appointment.
Okay, and I know a lot of people just say, and you see that commercial all the time, it's just the flu, but just the flu really can develop into a lot of other things.
Correct. I think the highest risk of what we're seeing, especially in folks who are older, is that it does create complications for their other illnesses and leads to hospitalization. The thing that we know so far is that the current vaccine that they've developed is really well matched. So we know that we've had quite a few hospitalizations and deaths that have been prevented from this vaccine. However, because it came so quickly, not a big percentage of the population already had the vaccine. So it's hard to tell if we're going to have probably yet another wave of flu in our community. And so I think the benefits of getting the vaccines are still there. So if somebody hasn't received the flu vaccine yet, it's a great time to go get one.
All right, we've got about a minute left. People always wonder, how long do I need to stay home from work or school if I've had the flu?
Right. In a workplace, usually at least within healthcare, we ask people to stay home, and they shouldn't be back to work. It's usually 5 days. They shouldn't be coming to work if they're still having a fever. They should be fever free for at least 24 hours, not taking any medications to prevent that fever. We know that you're probably infected can be infectious for those first few days, about 4 days. And so staying at home makes the most sense. And then if people are kind of just feeling unwell and still have to attend somewhere, putting on a mask, does wonder at preventing infection from being spread to others.
Okay, so 5 days, but definitely 24 hours, fever-free, with no Tylenol or Advil or anything. That is the key. Right there. Okay. Thank you so much for your time and your expertise. You can find a full recap from today's Q&A on WFMYnews2.com in just a few moments. Click in the To Your Wellbeing section.